Is This Normal, Doc? A podcast sponsored by Tanner Clinic. Hello, and welcome back to another episode of Is This Normal, Doc? The podcast where we talk about what's normal and what's not with the expertise of our Tanner Clinic providers. I'm Hope, and I am your host, and today joining me as my co-host is...
Hi everyone, I'm Chelsea.
And we are so happy to be back with you. Our guest for today is Dr. Jalee John. She's an OBGYN in our Layton Antelope B building. And I'm going to give her the opportunity to tell us just a little bit about herself and how she got to this point.
Hi everyone, I'm Dr. Jalee John. So as she said, I'm over in the South building. That's the smaller white one that's off the Antelope Parkway. I have been at Tanner Clinic. I'm starting my 4th year now. I'm out in Utah, fresh. I absolutely love the mountains, so that's what brought me out here, and family, of course. I'm from Nebraska originally, and then I moved out to Indiana for school, and then finished all my training out in the Philly, Jersey area. So it can be really intense, and Utah's a nice break from that standpoint. And I love Tanner Clinic out here, planning on staying out here as long as I can. My husband's also a Tanner Clinic physician, one of a nocturnist hospitalist, so we're a Tanner family.
We're going to do our segment, Is This Doc Normal? So the first question that we ask everybody is, who is your favorite fictional doctor?
This one's super easy to me. I don't know if it counts as a doctor, but Dr. Strange, he was a surgeon, so as a surgeon, I can appreciate kind of like his fine skill and talent. And then I also think his journey's really cool. From someone that's always looking for self-improvement, his journey is really remarkable there, and I'm a huge fantasy person. So throwing a little magic with a little surgery, and you got me. If there's a dragon, then it would be perfect. I bet he could whip one up if he wanted to.
Yeah, he can basically do whatever, right? I wouldn't have ever thought of him, to be honest, if that's a good answer. And yes, he does count as a doctor because he is. That's how he got his name. Because he was a doctor first. So, what is the last show you binge watched?
I think Ted Lasso for sure was the most recent. I'm a huge soccer fan, so that's an easy grab for me. And then also a little bit with the kids. Not all the language is always good, but it's just so wholesome to get his perspective, and always makes me laugh and have a good attitude after.
Yeah, I know. It is such like a feel-good show. Like, you can't watch it and walk away feeling bad about life. If you had to wear one color every day for the rest of your life, what color would it be?
So I actually probably only wear the color purple. Remarkable today that I don't have any on me. My whole office is purple. All my clothes are purple. All my shoes are purple. Everyone always asks me like, "Oh, you matched your outfit so good today." And it's like, I actually only own the color purple. So I just
was everything is the same color. And that's a good philosophy to have. There's like that one lady. I don't know why that question just made me think of that one lady that only wears green and only has green stuff. Have you heard of her? She like lives in New York. She has green hair, green clothes, her house is green, everything she uses is green, and so people will see her walking around and be like, "Oh, it's the green lady. You should be the purple lady."
I will be the purple.
Would you rather never eat again or never have to sleep again?
Again, pretty easy. You're throwing me some. I love sleep. I get so much enjoyment out of it. As an OB, I don't, always get it very often, so I can really cherish and appreciate it. And so definitely sleep. I do love food, but I am one of those people that have that food noise all of the time. So if I could just take that off the table, that would be great for me.
That made me want to choose sleep as well. I would also choose sleep.
Napping, great napping.
Yeah, I do love food, but it is like a big thing for me. Like, I love it too much almost. So
yeah, just take that off the table.
I know.
Good,
and you're good. Today, we are talking about something that I feel a lot of women don't know a lot about, which is very unfortunate. We're talking about vaginal health and your menstrual cycle. So it'll be really interesting since, we're all women, that I could probably learn quite a few things today. The first question I have for you is about discharge. That's something that never really gets talked about. So could you kind of go over what's normal with discharge and when maybe someone should be concerned about their discharge?
Discharge is normal, and there is also a little bit of odor. So I actually get this question all of the time, that people come in concerned about discharge, odor, any of that sort of stuff. And then we kind of dive into it, and it's like, oh, okay, like this is normal. That's an okay thing. Your body's doing what it's supposed to.
Yeah.
So in general, discharge should should happen. And if you're not on any hormonal contraception, it kind of changes with the menstrual cycle. And so it's there to help kind of protect, it's there to self-clean, and it's something that you should have some of it.
Does the volume of it mean anything? Like, you said it shouldn't be concerning no matter how much you have.
If it starts to be itchy or irritating, things like that, if you do get a lot of excess discharge, then it can really trap the moisture and then cause things like yeast and BV. So there is a threshold where it kind of can cross over to bothersome and increase risk for infection. But in general, some moisture down there is all good.
Is there anything like, as far as like food that we eat or things that we can do that would cause us to have more discharge?
Diabetes is a big one, just kind of sugar control in general. If you're consuming a lot of sugars, then it definitely puts you at risk for more yeast infections, kind of throwing off your natural pH and the natural bacteria that are in there. So obviously, healthy lifestyle and diet for all things. We love exercise, but along with exercise can be a lot of sweating and moisture retention down there. So making sure that you're smart about it. And if you're on your Hawaii beach vacation, not staying in those wet swimsuits and really holding that moisture there. Whether it's those really fancy silky underwear or in really lacy underwear can definitely do it. The swimsuits, the tight leggings, everyone always blames leggings. It's not necessarily the leggings, it's the air amount we can get with the leggings.
So breeze. You're in more of a breeze.
You want as much oxygen. No underwear at night is something that I frequently talk to people about if you can get away with it, or just like really loose boxers are all things that your vagina really wants.
Okay, so you kind of just touched on this. You said that discharge can change throughout the month if you're not on a hormonal contraception. Why is that?
So essentially, when you think about discharge periods, the body as a whole really is trying to get pregnant. And so around the time of ovulation, it's super thin and sticky and kind of clear, and that's trying to help the sperm kind of get up to the egg and get you pregnant. And then after you ovulate, it will change to a little bit like thicker, kind of white cement in a sense. It's trying to block the sperm from getting up in there because you should already be pregnant. And then before the period starts, it's getting ready. It realizes that it's not pregnant, and the discharge itself will kind of dry up. And so that's going to be a normal flux between kind of nothing and then bleeding and then super sticky and then super thick. So it's one of the ways that people actually can like track their cycles and try to get pregnant. There's a whole Creighton method, whole fertility method, just based off discharge.
I don't know if I could stay on top of it enough. Like I'm not that detail oriented of a person to like be able to document all that. Mm-hmm. My question is something that I know a lot of women are concerned about, and that is vaginal odor. So can you kind of tell us what's normal and what should be concerning with vaginal odor?
Yeah. So a light musty smell is how a lot of people will describe it. Can be normal. Every person is a little bit different. You know, like those lovely pheromones that people talk about for attraction. Just every body has its own unique signature and scent associated with it.
Yeah.
So being familiar with what's normal is always helpful. Yeah. And then if there's anything that changes, specifically like a super strong odor, fishy odor, yeasty, and then of course if there's some irritation and itching with it, we should all get it checked out.
So a little bit of vaginal odor is normal. Okay.
A little bit.
I was just thinking about like things that we can do for vaginal odor that are safe.
Mm-hmm.
What do you recommend?
So the vagina, definitely self-cleaning. That's what the discharge is trying to do. And so airing it out obviously will help minimize the odor. But then the other big thing is really not doing any like douches or wipes or scented soap. That all can actually irritate it and make it worse. And so you really want to be hands off with the vagina and just do a little water rinse down there is all you want to do.
It's good to know. They feel like people try and counteract that.
And there's also marketing brands for everything is like bruises and florals, and that can actually cause more itching ear.
And I swear there's ones that like kind of claim to be like pH balancing and doing, but you still don't recommend any of those?
Kind of. There's definitely a fine line of what's healthy and what's not healthy. So as a general rule, stay away from them. And then if you're having persistent issues, then we can talk about it.
Yeah. Talk to your OB. They'll tell you. pH. How important is that to keep it balanced? What are some things that can throw it off, and how do you combat that?
Is it the most important thing about the vagina? It might be. That's a big statement, but I might agree with that actually. So the vagina should be slightly acidic. There's so many different bacteria in it, different types. There's some good bacteria, there's the bad bacteria. The good bacteria is the lactobacilli. It actually makes acid and then helps your vagina stay more acidic. And so that's really good for the good bacteria and will help fight the bad bacteria like the yeast and BV, that things change when it gets more basic. And so really the problem starts for most women in these recurrent infections. If once the pH is thrown back and thrown off and the vaginal microbiome, all that good bacteria is thrown off, and then it's a battle to get it back to normal. So things in general that can kind of throw off the pH is semen is really like basic. Some lubrications, things like that can throw off the pH, obviously like antibiotics use. Other medications, sometimes like stress in general, can throw off your pH. So definitely, if your pH is off, it's an uphill battle to get it back.
Did I hear that wrong? But you said pH is one of the most important things?
I think so.
Okay.
I mean, the vagina has lots of important features.
I was not like contradicting you. I just think that's really interesting. So can you tell us the main differences between a yeast infection, a bacterial infection, and a UTI?
So, small caveat to this, I think a lot of times the symptoms really crisscross over. So, and the treatments are very different, and, doing antibiotics can make the yeast worse and things like that. And so if you ever feel like something's off, it's a really quick visit, 5 minutes. We can get the swab back in an hour or two, so you're not suffering for days.
Yeah.
And so come in, let's get a swab, let's get a good diagnosis. But in general, the yeast infection is going to be a lot more like thicker. That cottage cheese discharge is what people talk about. Irritation and even swelling is a little bit more common with the yeast infection. And that kind of classic bready yeast odor is what some people will talk about. I've never noticed that. I don't know if I'm just not very good at my bread identification, but as a gynecologist that sees lots of yeast infections, I don't know. I don't get the bread thing, but it's out there. And then BV is kind of the classic fishy odor, which sometimes people can get confused with kind of that natural musky scent that we talked about.
Yeah.
But something that's definitely like extra pungent. And then usually there's more of that like gray discharge, increased like thinner discharge with BV than with yeast. When it comes to urinary tract infections, you can get that little burning with urination that can happen with both yeast and BV because the tissue's just kind of irritated, so peeing can make it uncomfortable.
Yeah.
But if you're peeing blood at all, if you're going to the bathroom more frequently than normal, then that can all be a sign of like a UTI, along with just more like pelvic pressure and cramping. Then the yeast and BV typically don't have belly symptoms with it.
I can honestly say I've never had to deal with any of these things, but I know that's something that so many women are like prone to. And I feel I've known women that are more prone to getting like yeast infections and UTIs. So that information can be really helpful for them. But also I think that they shouldn't be afraid to just come in.
For sure.
I think a lot of women think that they're being dramatic. We try and like downplay our symptoms and just say like, it'll go away on its own. Or like, I'm just being dramatic, but.
Or sometimes it can be, just a stress change of your normal vaginal discharge that can happen, but it's always better to check instead of doing unnecessary treatment and antibiotics and things like that. I'd much rather you come in and be like, okay, nope, we've talked through it. It sounds normal. Swabs are negative. We're all good versus letting something linger that shouldn't be there.
She said that herself. You shouldn't feel embarrassed or like you're being too much by coming in, like they want you to come in. And I feel like that's a lot of women avoid that because they think they're being dramatic once again. Like I had a friend that was like, I'll just drink cranberry juice. And I was like, that's not going to fix your UTI. That's a preventative thing, if anything.
Well, in every exam, every patient, whether they're there for periods or discharge or pain with intercourse, no matter what it is, every single person feels awkward in the office. Yeah. And even like I feel awkward as a gynecologist going to like my own gynecologist. I'm like, why am I sweating? Like I do this every day. Why is this a thing?
So I think it's good to talk about it too. And that's what I love about this podcast is I love being able to ask these questions and help people understand that like these types of things are normal. Vaginal discharge is normal. Like a little bit of a light odor is normal. Things like that. And they should never feel embarrassed or like scared to come in and ask those questions because it is something that you see every single day.
100%. And it doesn't freak me out. I haven't run out of a room crying yet.
I feel like the morning of your OB appointment, you do like the really extensive shower where you're like, okay.
Yeah.
gotta
Having,
prep.
clean feet, smelly shoes, maybe not the best choice, but everything else is fair game.
Are recurring infections common? And when should you start being concerned that you keep having the same infection come up?
Sporadic infection here and there, like everyone usually will get some sort of like yeast or BV or UTI once or a few times throughout your lifetime that are all just those situational, something got thrown off. But if you're having an infection 3 times a year, that 3 times recurrent is what we call recurrent, and we really need to dig into it and do different treatment and really work on getting that pH balance back to normal. And so that's one of the reasons why it's important to come in, because sometimes you can have irritation for a day or two and it resolves and it's not necessarily a true infection. So we really want to know if you're having, is it 3 episodes of BV or is it 3 episodes of yeast? So then we can do the right treatment and tackle it that way. Definitely lots of different things that we can do and lots of different things that we can work on. We just need to get the diagnosis to start with.
I feel very lucky that I haven't had any of these infections yet in my life, but I know the day will come.
I feel like a lot of people who have UTIs just go to like a family medicine doctor.
Or like urgent care.
Or urgent care. Would you recommend that they make an appointment with their OB, like over those other specialties so that you guys can have more of an...
One of the really easy things that we can do is, especially if I've seen you before as a patient, if you have a history of a UTI, we can actually just put in a standing order for urine culture. So then you don't even need to like come into the office and have an appointment. You can literally just go to any of the Tanner Clinic labs, drop off a sample, I can see it, I'll call you. And so then that way, if it's the same bacteria that's just not getting treated all the way, or whether it's a more recurrent issue, anything that we really need to dive into, we have everything there available for us, and it saves you kind of time and money and effort and all of that good stuff. So definitely recommend just calling us and we'll put in a urine sample for you. But then in the long term, it doesn't necessarily matter who you at least start with. Once it gets to the recurrent, when you're having 3 a year, most of the time it will either be us as gynecologist or urologist are also the other ones. If it gets to the point where we've tried treating it and have been unsuccessful, then we'll actually fall back to urology to see if there's some sort of stone or something more kidney related that's making these things happen more persistent.
I feel like people sometimes don't know what their options are, and they might think it's like too inconvenient to try and make an appointment with their OB. So
yeah, I totally get it. But if we can get a sample, that makes me happy.
Yeah. Just finishing up on vaginal health, can you tell us, do you have any recommendations on any supplements or vitamins that we can take for our vaginal health, maybe our pH? Is there any that help with that?
Yeah. So there are a lot of things out there. We already talked about be careful of the vaginal health washes and scents and all of those wipes we really want to avoid. One of the more basic things that we believe is pretty helpful. Obviously, we don't have great study data on the area of like probiotics. There are actually probiotics that you take by mouth that kind of go through the GI system and then cross over to the vagina that way. And there are actually some vaginal suppositories as well that you can just put them right in a spot of action. And then boric acid is one of the other things that, like, as a gynecologist, I really love. But typically we should have a conversation about it, kind of see when are the symptoms happening. But for some people, when you get that pH shift after your period, people can be prone to getting a BV infection every single month after their period. And some prophylactic boric acid can work wonders for that. Or after intercourse, if you're really sensitive to your partner's semen, doing a boric acid after intercourse can help those recurrent BV infections. So we should chat about it. There are a little bit of risks and irritation that can happen with boric acid, but in general, probiotics and boric acid are the over-the-counter things that I would recommend for your vagina.
So we've gotten quite into depth on vaginal health. So I think we're going to make this a 2-part episode. So follow us on our social media. We will make another episode specifically on our menstrual cycle and what's normal and what's not with that. So look forward to that, and we will see you next time.
Disclaimer: the information shared in this podcast is for general informational purposes only and should not be considered medical advice. While our podcast will provide helpful suggestions and insights, every individual's health situation is unique. For specific medical advice, diagnosis, or treatment, please contact your personal health care provider.